Hi. I'm robo-Suzie and today I'll talk to you about 10 important facts you must know about nail fungus before choosing a treatment. Also don't forget to check out the link below, to find out how I got rid of nail fungus fast and easy. I was so happy it worked. But back to our topic. Many people are not informed well enough to know that if they have a fingernail or toenail fungus infections, the worst problem is not how their nails look. Unhealthy looking fingernails or toenails are an indicator of a much more serious health problem that is important to deal with it before it gets worse. Here we will discuss some basic facts that you would be very wise to take into full consideration if you have nails that do not look healthy and right. Fingernail or toenail infections are pretty much like any other infection. They are a medical condition that very often involves the out-of-control growth of a live and active fungus. The way fungus grows is by eating your skin and nail tissue. If it is left untreated, it will continue to devour your flesh and will result in a condition that is much worse than it has to be. Before buying any nail fungus cream over the counter or attempting to cure your nail fungus in any way, there are some important facts about nail fungus that you ought to know. The fact is that nail fungus often causes a much worse problem before long if it is left untreated. Treating it is very important, so you should not put it off. You may be sorry if you do. 1. Fingernail and toenail infections do not just go away by themselves. If you are not proactive in treating a finger or toenail infection, the fungus will most likely get worse. If you ignore it for months or years, the infection will get deeper into your system and will end up spreading to other parts of your body. That is why some nail fungus treatment protocols are exactly the same as jock itch or athlete's feet treatments. If you cure one, you will most likely not have the other when you are done. 2. Topical-only treatments for deeply entrenched fungus cases will take much longer to work than if the infection had been caught earlier. The treatment ointment will not be able to penetrate as necessary to get to the infection. Once the infection is to that point, an oral remedy is usually necessary in conjunction with the topical, and many oral treatments carry very serious risk of negative side effects. 3. If you ignore toenail or fingernail infections, they will eventually cause pain and disrupt your normal daily activities. Nail infections often spread to other nails and even to other people who shower, swim or do sporting activities near you. 4. Nail infection is encouraged by damp, warm, and dark environments. The more you can leave your nail infection out in the sunlight and out of moist socks and shoes, the better your chances are of a cure. This goes against what people usually do because it can be embarrassing to show off ugly, cracked, scaly, and deformed toenails. Painting nails with polish to try to make them look better is one of the worst things you can do if you think you are getting a fungal nail infection. The earlier you get treatment, the faster and easier it will be to get your healthy nails back again. 5. Ignoring a nail infection is not a wise thing to do. That has been said before, but it is worth repeating. Without the proper treatment, a nail can become thick and completely deformed and often will become even painful. This thick deformity can lead to increased pressure on the toes around the nail because your shoe will press down on it. Painful and grown toenails or fingernails are often where the fungal infection leads. 6. Severe cases of nail fungus have one likely treatment. A podiatrist will often recommend is removal of the entire nail, after which he will prescribe an internal, prescription antifungal medication. These medications often carry a high degree of risk to your liver and other organs, so if you can avoid having to take them, by all means do so. If you've known anyone with severe ingrown nails, you know this is not something you want to let happen to you because of the life-altering pain involved. 7. Fingernail and toenail infections are most often fungal infections. This kind of infection often leads to bacterial infections that spread to other parts of the body. People with advanced fungal nail infections often end up with athlete's foot and/or an infection of the skin in the groin area, sometimes called jock itch. Treatments for the different types of infections are usually similar. 8. For elderly nail fungus sufferers, the fungal infections often lead to other skin irritations or complications and inflammation called cellulitis. People with diabetes or any condition affecting the circulatory system may experience additional limitations to their circulation caused by serious fungal infection if they do not treat it when first noticed. 9. Don't try to cut a thickened toenail yourself. Filing it is a much safer approach to getting rid of some of the infected tissue during treatment. Cutting can result in damage to the skin around the nail, leading to an infection or slow or non-healing wound. 10. People with toenail infections say it often has a negative impact on their self-image. Don't let your infection get that bad. It makes you feel self-conscious when doing any activity where people may see your feet. Don't let this treatable irritation cramp your lifestyle. Instead, do the research necessary to find out what the options are, what the best one is for you, and then take the required action to gain your healthy nails again. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.